This is Sara Flack, the Education Coordinator at the Child Advocacy Center of the Finger Lakes. For this week's webinar, we'll be talking about how to safely return to school in 2020, with a focus on staying healthy during COVID-19. First, we want to make sure that we are planning for a safe return for all of our students and children. This includes at least 5 things. First, I want to emphasize on practice is key. Whether it's wearing masks or proper hand washing, the best advice we can give is to start practicing and to start practicing now. Don't expect things to be perfect at first. After all, these are children. By practicing at home, you give children a safe space to work on how long they can wear a mask, how to wear it comfortably, and when it would be okay and appropriate to take a break as needed. We can also teach them the mechanics of proper hand washing. 2, we want to work on building that mask endurance. What I mean by this is building the amount of time that children are able to comfortably wear their mask. At first, it will feel very difficult and uncomfortable to breathe with a mask on. So if we start in small increments and build our way up each day, prior to returning to school, children will feel more comfortable to keep it on for longer amounts of time. As with any new habit, we recommend starting small. By starting in increments, you can see how they're tolerating it and build up accordingly. Try to find a comfortable mask and reward them for the time they wear it by doing fun things while they have it on. Some things that I've seen parents doing recently is having their child and themselves wear a mask while they're playing board games, or allowing their child to only play video games while they have a mask on. This encourages them to keep it on for longer amounts of time, and eventually they begin to have it as such a habit that they barely notice having it on. Make it fun, as in make the mask fun for the child to wear. You can do this in many ways. You can have fun fabric and fabric that reflects your child's personality, whether it's their favorite sports team or superhero, or their favorite color or pattern. You can also have your child decorate their own mask. If you're using plain white fabric, your child may want to tie-dye their mask, or they could decorate the outside of the mask with fabric markers or puffy paints. You can also allow your child to attach wings or something of that nature to the sides of their mask. And some places even have fun holders for the masks that go around the back of the head so that it doesn't pull on their ears. Try to make the mask something that your child enjoys wearing. Explain the why. As we all know, young children love to ask that question, and it's important that they get solid answers. Talk to your children about germs and how the mask can prevent them from spreading viruses. Older kids may have decided because they think it is not cool or they are afraid it will contribute to acne, so it would be important to discuss the why behind wearing a mask so that they are armed with information if they experience peer pressure to stop wearing it. The CDC has some great tips on how you can discuss COVID-19 with your kids, including remaining calm and reassuring. Lastly, you want to talk to your children about taking breaks. It's important for parents to have a discussion with children to make sure they understand that if they need to take the mask off for a breather at school, to make sure that they are away from people and have permission to do so. Many schools are actually building in mask breaks for their students. This may mean that the students are allowed to take their masks off while at their desk if they're able to practice the minimum amount of social distancing, or it may mean that at certain points during the day, small groups or cohorts of students are able to go to larger areas or even outside in order to take their mask off and have a break. So just a little more about mask wearing. And as you can see, this graphic is from the World Health Organization, and it's just kind of describing some of the things that you should do in order to properly wear a fabric non-medical mask safely, which in most cases will be what our students are wearing when they return to school. Before putting on your mask, you should make sure to wash your hands, inspect the mask for any damage or if it is dirty or soiled. If it's dirty or soiled, do not wear that mask. Find a clean one. Many schools are also offering students who soil their mask during the day the opportunity to swap out for a fresh mask and will have masks on hand if necessary. You want to make sure that you adjust the mask to your face without leaving gaps on the sides. It should cover your mouth, nose, and chin. Many masks have elastic straps. However, you can also get ones with ties, which for some smaller children reduces the pulling on their ears and provides for a tighter fit. Once the mask is on, you should avoid touching the masks. And you should also clean your hands before removing the mask. Removing it by only the straps behind the ears or the head will keep you from soiling the fabric that covers your mouth and nose in case you need to put it back on in a few moments, like when you're taking a mask break. You should pull the mask directly away from your face and store it in a clean plastic resealable bag if it is not dirty or wet, or you plan to reuse it. Again, you're going to remove the mask by the straps when taking it out of the bag. And at the end of the day, you should make sure that you wash the mask in soap or detergent, preferably with hot water at least once, and clean your hands again after removing the mask. It's a good idea to consider having multiple masks that your child can wear throughout the week. I recently saw at a dollar store that they are selling masks that are labeled Monday through Friday, much like you would see packs of socks for young children. This helps them make sure that they're utilizing a clean mask each day, and you only have to you can wash all the masks together at the end of the week. Be sure that you have somewhere clean to store your clean masks or any extras or backups that your child plans to take to school in case of an emergency change. Next, I want to just quickly talk about hand washing. Hand washing is important and can be done in 5 easy steps. Step 1, you want to wet your hands with clean running water. Step 2, apply soap and produce a nice lather. You should continue to scrub your hands for at least 20 seconds. In order to do this, you may want to have your child sing a song or hum or sing it in their head, something like the ABCs or Twinkle Twinkle Little Star, so that they're washing for a long enough period of time. Also teach them that they should cover their entire hand between their fingers, front and back. Then you want to make sure that you rinse the hands well to get all of that soap off and dry your hands thoroughly. If soap and water is not available, you can use hand sanitizer, but it's important to remember that hand sanitizer is not 100% effective and that they should regularly be washing their hands with warm water and soap. The friction produced by scrubbing for 20 seconds is the #1 way to remove any bacteria from the hands. Be sure to talk to your children about the school rules and how you're going to help them follow it. School rules vary by district and by level, but some of the most important ones that I've been coming across are that many schools are now requiring students and staff to complete health checks before attending school in the morning. This would include acknowledging and attesting that they have no visible symptoms, have not traveled outside of the state, and that they are temperature checking. Some schools may also be doing temperature checks as children enter the building. As always, you should stay home if you are feeling unwell. And thirdly, if you are experiencing any symptoms related to COVID-19, it's important that you report them and that you see a medical professional to be tested and cleared. Until you do so, you should remain at home And just some other health reminders. You want to avoid touching your face. Throughout the day, your child will be touching a variety of supplies and surfaces. Although schools, teachers, and students will be regularly disinfecting these surfaces, you don't want to take the risk of touching your nose, eyes, or mouth and being infected with the coronavirus. You should always cover your cough or sneeze. When able to, use a tissue and then immediately dispose of that, and be sure to wash your hands. If you're unable to cover your cough or sneeze, it's a good idea to cough or sneeze into the crook of your arm or elbow. Avoid close contact. In New York State, the recommended distance is 6 feet. While at school, children are also to be following a 12-foot radius when in music class, playing instruments, singing, or in physical education. We also want to be sure that students are using their own supplies and are not sharing. This has posed some problems for many school districts and for people at home. However, we're doing our best to make sure that every student has their own supplies as to not share any germs or bacteria with fellow classmates. And again, we just want to make sure that we're disinfecting those commonly touched surfaces, whether that's pens, pencils, desks, doorknobs, telephones. Everything that you touch, you want to make sure that you're disinfecting regularly. Remind your children that they should also be disinfecting any of their electronics. This would include any Chromebooks or laptops or iPads that are used at school, as well as their cell phones and calculators. For more information, you may want to visit the Centers for Disease Control and Prevention website at www.cdc.org or the World Health Organization at www.who.int. I can also be reached at my email address, which is listed below, sarah@cacfingerlakes.org.